Okay, thank you very much. And now we will call upon Dr. Chalapati Reddy. He will be presenting on papilledema in young. Huh? Iris claw implantation, our experience in regional eye hospital, Kurnool. Hi.
Good morning all. Today I am presenting our experience at Regional Eye Hospital about iris claw lens implantation in Kurnool. And my co-authors are Dr. Salim Basha, Niharika and Chandana. And I have no financial disclosures to be made. And coming to this, and we have about 66.2% of avoidable blindness in the form of cataract in our country. And of this, 1.7% are aphakics. Now aphakia is not acceptable because of the intraocular lens modifying everyday visual needs of the patients, and the prevalence of aphakia is secondary to perioperative complications during cataract surgery should be managed well to avoid complications of aphakia and their anisometropic complications. So the challenges to overcome this aphakia during the procedures. We have these situations like we can implant either a snail fixating IOL, either glued or a sutured one, or an anterior chamber IOL implantation, or the latest retro iris claw IOL implantation, retro or anterior. And other possible management options are keratophakia and epikeratophakia, which are not regularly practiced. And our objectives of the study is the instance of poor posterior capsular support due to PCR and zonular weakness, and the need for retropupillary iris claw implantation as a primary or a secondary procedure, and to assess the complications and visual outcomes with this retropupillary iris claw IOLs has been done, and to assess the technical feasibility as a primary procedure in cases of PC rents and weak zonular supports, and also as a secondary modality in managing pre-existing aphakia. Our inclusion criteria being patients with no capsular support or extensive posterior capsular rents, or with weak zonular support, and aphakic patients referred from other centers, and patients with PCR secondary to trauma. And exclusion criteria are comorbidities like insufficient iris tissue or thin iris tissue and neovascularization of iris, secondary glaucomas and decompensated corneas, and posterior segment pathologies. And methodology being it's a non-comparative prospective interventional case series study of retropupillary iris claw IOL implantation for a period of 1 year, that's from June 2022 to June 23 at the Peruggi Siva Reddy Regional Eye Hospital, Kurnool. And preoperative evaluation includes the general physical examination of the patient, the best corrected visual acuity and slit lamp examination, and biometry, and retinal evaluation, and intraocular pressures were evaluated. And our results are like, we have done about 3,000 IOL implantations during that period, and out of that 70 were retropupillary iris claw IOL implantations. This number looks big, but out of the 70 patients, 59 patients, that is 85 or 84% of the patients are posterior capsular rupture or vitreous disturbance perioperatively, and were managed with a primary iris claw IOL implantation after thorough vitrectomy. And 11 patients, that is about 16% of the patients were pre-existing aphakics, where we did a secondary IOL implantation with retropupillary iris claw IOL implantation. Most of the patients are in the age group of 50 to 80 years. And the amount of this is about 2.3% of the total number of IOL implantations we have done. And as I told you, and we have followed these patients for about 3 months after the implantation. And most of these patients had very good IOP, in about 67% of the patients the intraocular pressures was normal, and only 3 patients has raised IOP, and which was controlled well with topical medications alone. And visual acuity was good in almost 90% of the patients, so like 65% of the patients had vision between 6:9 and 6:18, and only 3 patients had poor vision, and the cause for poor vision is because of the severe AC reaction and endothelial decomposition in 1 case and cystoid macular edema in 2 cases. And pupil abnormality, that is gross ovalization of pupil or irregular pupils, was seen in about 7 patients, and iris abnormalities like the exposed haptics and the enclavation site was seen in about 3 patients, and glaucoma was seen in 3 patients, which I have mentioned earlier. This is the table showing the complications which we have seen. And coming to the discussion, retrofixated IOL implantation has become popular among surgeons because of its viability, and also iris claw lens haptic lens is easier, learning curve is easier, and its implantation is simple, and as a primary procedure it can be done without much fuss in the theatre. The present review is based on literature and our clinical experience at our institution, and the focus on surgical techniques and outcomes especially related to the characteristics of these IOLs, having haptics with the claws or a small fissure which is for enclaving. And implanting retropupillar IOL has been relatively short, has a short learning curve. Retropupillar iris claw IOLs demonstrated generally a favorable efficacy and safety also. However, the outcomes are probably more influenced by the reason for surgery and comorbidities than the IOL itself. This is the lens design. This is a modified artisan lens with a vault upwards that creates a distance between the iris and the lens. And enclavation is easier in these lenses because there is a larger aperture between the optic and haptic, and the haptics are enclaved and attached to the virtually immobile middle of the iris, so it doesn't restrict the pupil dilatation and constriction. And this is the model of, this is the worst iris claw oval lens, and the next to that is the artisan modified FAK IOL. And this is the lens. This has a diameter of about 5 millimeters, and the optic size is about 5.5. The total body is about 5.5, and a diameter is about a maximum diameter about 8.5 millimeters. And it comes from 14.5 to 30 diopters, and the sizes can be ordered for smaller eyes and pediatric age groups. And A constant being 115.0.
The time is up.
Yes, sir. Indications in extensive journal dialysis and PC range, this can be a primary procedure, and the same sitting we can do the surgery, and it has good outcomes. And these instruments are required in our emergency set on iris claw forceps and enclaving rod. Thank you, sir.
Excellent data, and congratulations for those numbers. Your study lags behind on the scientific content. Like it's lagged behind the scientific content. If you see your aim of your study, it does not support the methodology which you have followed. So if your aim should have been safety and efficacy of iris claw, and you should have included that when the patient undergoes this particular surgery and what is the methodology that you use for your surgical thing. Then on what follow-ups you are going to see the patient, and in each follow-up what are the tests you are going to do, like specular microscopy, OCT, fundus examination, and you should have given an average of endothelial cell count average of those patients, what were the complications. So this would have been a better methodology for your, so you have done such numbers. If only if you had included this methodology properly, it could have been much more meaningful.
Because of the time factor, we could not include most of the slides, sir. And ours being a teaching institution, we have a lot of PGs and trainees doing the surgeries, and so we have so many numbers of PC ranks and complications per
That's
operative.
right. If you included the numbers, it would have been a very good
Initially we
answer.
were doing it at a later stage. Now we have started doing it on the same sitting after doing thorough vitrectomy, and PA has been done at the non-enclaving site, with the temporal or so vertical. And this numbers itself just to show that iris claw lens is easier for even anterior segment surgeons to master the technique.
Thank you.
Thank you very much.
Now we will call upon Dr. Naini, Ravi Naini. She will be presenting on papilledema in young unveiling COVID-19 connections.
A very good morning, everyone. Here I am Dr. Nainin going to present about the papilledema in a young and unrevealing COVID-19 connections. There are no financial interest and conflict of the interest. And coming to my introduction, as we all know that the idiopathic intracranial hypertension is a rare disorder characterized by increased intracranial pressure in an unknown cause. And several neurological manifestations have associated with SARS-CoV-19 infection have been described since the beginning of the pandemic. So in the cohort study of hospitalized severe COVID-19 patients, most of the neurological complaints has occurred in 45.5% of infected individuals. However, there is a still controversy surrounding the diagnostic criteria of idiopathic intracranial hypertension. So our main aim to evaluate the causes of papilledema in the young age group following COVID-19 infection or COVID-19 vaccination at JIMSA Teaching Hospital, Visakhapatnam. So coming to our methodology, we have done a cross-sectional case series in 84 young patients are screened who came to the Department of Ophthalmology in the JIMSA from September 2022 to and May 2023. So here the patients were evaluated on the clinical judgment and the modified Danish criteria. So coming to our method, we have already assisted the comprehensive assessment including ocular examination, visual field testing and brain imaging which were performed in the diagnosis of papilledema. And where the papilledema has diagnosed, we have treated with the symptomatic treatment by neurologists like acetazolamide, ivimannitol and anticoagulants, etc. So in our inclusion criteria, we have included the patients above 15 years of age and the patients with a history of COVID and post-COVID immunization within 6 months who develop the symptoms and the patients who are under steroids during the COVID infection. So exclusion criteria, we have excluded 15 years, less than 15 years patients and the patients who had already history of coagulopathies, abnormal prothrombin factors and neurological diseases were excluded, and the patients who are recovered above the 6 months from COVID and the post-COVID immunization beyond the 6 months were excluded. So coming to our results, here out of 84 patients who we have screened, there are 18 patients have diagnosed as papilledema with the history of COVID-19 infection or vaccination. Out of 18 patients, 12 were female and 6 were male. In that, most of the patients have normal body weight, where 3 are obese, mostly are female, and the mean age is 22.5 years, and the 5 patients have history of oral contraceptive use, and there is no history of steroid intake. So the fundus generally relieve the bilateral papilledema of various grades. This is the picture of one of the patient of 26 years female, shows the bilateral papilledema of post-COVID infection showing the elevated disc edema with an hemorrhage. And after his 4 to 6 weeks of the treatment follow-up, there is a result of a symptomatic relief and regression of papilledema in those patients. So distribution of COVID-19 causes of papilledema, we have seen out of 18 patients, idiopathic intracranial pressure hypertension has seen in 11 patients and cerebral venous sinus thrombosis seen in 4 patients and in meningitis are 3 patients. So this is an MRI scan with P1 which shows the subarachnoid space of optic nerve sheath with optic nerve sheath tortuosity. And in our study, coming to the discussion, so we have diagnosed idiopathic intracranial pressure in 11 patients. So the main hypothesis here, it may be the increased intracranial venous pressure or venous outflow abnormalities, alternation in any absorption and production of CSF, or there may be intracranial vascular clotting. So according to in this study, so we have got the CVST in 4 patients. It may be due to associated with any coagulation dysfunction. The main pathognomic mechanisms can be endothelial dysfunction with increased level of von Willebrand factor and systemic inflammation, a poor coagulability state. So reports have estimated that cavernous venous sinus thrombosis or prevalence is higher in patients with COVID-19 with rates reaching of 0.02% to 1% in hospitalized COVID-19 patients. So finally, the take-home message and the conclusion, the upsurge of IIH may attribute suggest a potential association between IIH and factors associated to the pandemic, and the COVID-19 infection has been associated with various coagulable disorders including CSVT, and further studies of etiopathogenesis in the age group are to be considered. Therefore, it's advisable to consult the last medical literature and studies for the most up-to-date information of the connection between the IIH and COVID-19. Here are the my references. Thank you.
What was the screening criteria?
So we have taken mostly the engaged group, and
No,
we
what
have
was, like you said, symptoms. So what does that mean? Who were the
symptoms.
screening?
Generally, the patients who came to the OPD with the mainly blurring of vision, there is a defective vision associated with the vomitings.
So blurring of
and
vision and
headache.
vomiting was the criteria for
Yes.
screening. So all those patients who had blurring and vomiting were screened.
Vomiting
After
and
that
the
you found
history
this.
of COVID.
This was this. Now, how do you correlate, like, this is the IIH, idiopathic pulmonary hypertension, with the COVID? How can you pinpoint that? Why is it not that it is IIH alone, they are presented in that period, versus the vaccine related? So how many of these patients who
So
were,
generally we have screened totally engaged group mostly or 84 patients we have screened. Out of that we have got only the 18 patients. In that only we have gone that, and most of them are IIH. Okay, in that generally if there is any intracranial pressure increased, it may be due to the usage of the steroids or due
what
to
I
the
mean
any
to say
kind
is,
of
if you have
vaccination.
compared your data with pre-COVID, if you had during that period, screening those many patients, if there is an increased incidence in the same sample, same race, same people, it will have given a better information.
Yeah, in
Anyways,
simple
good
terms,
data,
what
nice
is the
presentation.
control group actually?
Okay.
What is the control group in your studies? Means you should have seen the same OPD population simultaneously presenting without COVID positive.
Without COVID.
That could have been a better test. Okay, thank you very much.
Thank you, sir.
And we concluded this session. The marks will be compiled by the scientific committee, AP State of the Minister Secretary. They will announce the results.